Hi, I'm Dr. Mrs. Choma Uchumi. Today, I'll be talking about something that affects thousands of women in the world, but yet is preventable: cervical cancer. Every few minutes, one woman around the world dies of cervical cancer. But the thing is that it's actually preventable. With good awareness, self-care, this can be prevented or dictated early. So what is cervical cancer? Cervical cancer is cancer that occurs in the cervix. You may be wondering, which part of the body is the cervix? This seen in the female, that's in women, is the cervix is the lower and narrow part of the uterus. The uterus, that's the womb, connects the uterus to the vagina. That's a place where maybe a woman is pregnant and ready to deliver. They say it has to dilate to enable the baby to come out. 5 cm, 10 cm dilated, then the baby can come out. That's the cervix. The cervix is that lower and narrow part of the uterus. And this is seen in women. So what are the causes of cervical cancer? Now, one, human papillomavirus. This a virus. It causes about 70% of cervical cancer. This virus will have different types of it, but the main strain that causes cervical cancer is 16 and 18. And you can get this through sexual intercourse, other processes. So human papillomavirus can cause cervical cancer through multiple sexual partners. Yes, different, sleeping out with different partners. Then early sexual intercourse, like one starting sexual intercourse very early in life, causes cervical cancer. Then tobacco, as in smoking. Smoking can also predispose one to cervical cancer. Then also reduce or immunocompromised people, patients, like one that anything that can suppress one's immunity, like HIV, diabetes, this can predispose one to cervical cancer. So what are the symptoms of cervical cancer? One, at the early stage, it might not present with any symptoms, but as the disease progresses, you now start seeing some symptoms. One, abnormal vaginal discharge. This could be in between periods or during sexual intercourse. Everyone, after having sexual intercourse, you just notice some droppings, as in blood. It's a warning sign. Postmenopausal bleeding, like a woman that stopped seeing her period. You stop seeing, you're already having menopause, and all of a sudden you start seeing some discharge, blood, as in discharge, like blood. It's a warning sign. You need to see your doctor. Then unusual vaginal discharge, like foul-smelling, watery vaginal discharge. Although in some pelvic infections, you can actually have vaginal discharge. But when you have foul-smelling discharge, you should also think about it. Pelvic pain or pain after sexual intercourse. These are some of the signs that when you see them, it's a warning sign that you need to see your doctor. Then, is this preventable? Yes. How do you prevent this? One, I'll talk about screening guidelines. There's something we call pap smear. And every woman within the age of 21 years to 65 should do have your screening, as a pap smear screening, regularly, at least once in 3 years. I did mine last year. So it's very important that every sexual active woman should have this screening done at least once in 3 years. Then even vaccination, human papilloma vaccines are now given to young girls, as in within the age of 9 to 14. It might be different in some countries, but in Nigeria, 9 to 14 years. About 2023 and 2024, they did 9 to 14 years. But recently, they say this 2025 is 9 years. So please, parents, have your daughters vaccinated, as in let them have this human papilloma virus vaccine. This will help them. So vaccination is very important. Then sexual abstain. For me, abstinence. Because even using of the condom, you can still have traces of it. So abstain from sexual intercourse. Early sexual intercourse for a young girl, very early, and you're indulging yourself in sexual intercourse is a risk factor. Please abstain from sexual intercourse. Then regular screening. Have yourself screened regularly. Check it up. Meet your doctors. If you go to use some facilities around you, ask questions. We have a lot of facilities that do this screening. Federal medical centers, even state hospitals around. You can do this. Please, my young ladies, women, please, for us to save our lives and for us to live longer, prevention is better than cure. Please, first, have yourself vaccinated. Young daughters, parents, please vaccinate your young daughters between the age of 9 to 14. This is very important. Then screening. Please screen. Put it up in your daily plans. No procrastination. Go and screen. Pap smear. Once in 3 years. Please do that, and now abstain. This is very important. Thank you very much. I know this will help someone. You can actually share someone to actually say this. Thank you very much, and have a blessed day.